Hello and welcome to Ask the Experts by Salinas Valley Memorial Healthcare System. I'm Claudia Otero. Today we're focusing on how COVID-19 affects children, the variants, vaccines, side effects, and wearing masks at school. Our guest today is Dr. Carla Rosal. Dr. Rosal is a family medicine physician at Salinas Valley Medical Clinic PrimeCare Monterey. She is board certified in family practice. Dr. Rosal earned her medical degree from the University of California, San Diego School of Medicine Medical School, and has been practicing medicine since 1997. Dr. Rosal, thank you so much for being here with us today.
Thank you. Pleasure to be here.
Great. Well, we have a lot of questions to get to, so let's get started. The start of this new school year, as you know, is right around the corner. We know many parents are relieved and concerned to be sending their kids back during this pandemic. The Pfizer vaccine has been available for kids 12 and older for a couple of months now, and a lot of kids are being vaccinated, so that's great, but a lot are not. So let's start there. How soon do you think the vaccines for children younger than 12 will be available?
So currently, Pfizer is conducting several trials in children starting at the age of 6 months to 11 years. They actually have put out a statement where they are hoping to get emergency use authorization for the vaccine in the age group of 5 to 11 years by September, and in the younger group, 6 months to 11 years, sometime in the winter.
Okay, so that's right around the corner. Hopefully it will happen.
Hopefully.
September, okay. Well, how does COVID-19 affect children? What have you seen?
So COVID-19, being a respiratory infection, affects children in the same way that it affects adults, but it could be milder cases, and up to 50% of positive COVID-19 cases are asymptomatic.
Okay. And are kids at lower risk of contracting the virus than, let's say, teens or even adults?
So what we know is that children, at least children over the age of 12, can contract COVID-19 at the same rate as adults, and they have about the same viral loads, if not a little bit higher. We're not exactly sure how it is for the very youngest group, because a lot of those kids don't get tested, or their cases are so mild or asymptomatic that it's hard to say. But probably there won't be that much of a difference. They probably carry the same or a little bit higher of a viral load, and they can transmit it as, you know, at the same as any adult.
Okay. Sadly, we've lost over 300 children in the U.S. to COVID. Does it affect, I mean, I guess, why does it affect some worse than others?
Well, so even though the infection in children is much milder, as you mentioned, there have been some deaths. I mean, it's incredibly rare when we look at the, you know, millions that have been infected with COVID-19. But some children, even when they're healthy, can end up in a hospital, and they can have as severe of a course as an adult. So that, although it's rare, can just happen because it happens. There are some children with more chronic conditions that are higher risk of having a more severe illness. So we're talking about children that have conditions such as cystic fibrosis or other lung disease, chronic kidney disease, even type 1 diabetes.
Okay, so for those families who have kids who have some of those comorbidities, it's probably a really good idea that you continue doing what we've been doing, right? Wearing a mask, washing those hands as often as possible, disinfecting, keeping your distance, right? Because again,
Correct.
Children under the age of 12 so far are not vaccinated.
Correct.
Okay. What is the incubation period of COVID in children? Is it different from adults?
Not different, about the same, 2 to 14 days.
Okay, and if a child were to become infected, I mean, what's the next process? What should mom and dad be doing?
Right, so if there's any concern of any respiratory illness, the best thing to do is to call your physician or primary care provider and ask to be evaluated and get a COVID test.
Okay, so this brings us to the Delta variant, hot topic right now. So sadly, but for the past few weeks, health authorities have been warning about the Delta variant. It's a mutated version, as you know, of the SARS-CoV-2 virus. It's considered to be up to 60% more contagious, and it has now become, sadly, the dominant variant in the U.S. It's also considered to cause more severe disease. And in some parts of the country, we're seeing spikes in infections in communities with low vaccination rates. So Dr. Rosal, what do you say to people out there in our community here on the Central Coast who don't want to get vaccinated and who don't want to vaccinate their kids?
Right. Well, I'd like to say that I hear a lot from parents in my own practice about the vaccine in terms of having doubts or concerns. And I understand those concerns and doubts. It's a new vaccine. It was brought out pretty quickly. It's not FDA approved yet. But I do also want to say that even though it falls in that category, it's not that these companies didn't take all the precautions to try to make a safe vaccine. They have. They've worked different channels to make this happen faster, and plus some of the information and research was there prior to there needing to be an mRNA vaccine specifically for COVID. So the technology and the research was there. And then secondly, you know, healthcare providers recommend this vaccine because we have looked at the literature, we have studied the research, and I can say with confidence the American Academy of Pediatrics, the American Academy of Family Physicians, the American Medical Association, and numerous associations for the general public and pediatric groups have looked at this information and feel that the vaccine is safe enough for children. This is very important because, as you mentioned, there's this Delta variant, which is much more contagious. It's believed that it can spread a lot faster than the original strain that came out, so about 225% faster. In addition, it grows faster, it replicates faster in the system. So it can be spread a lot sooner, and it could actually potentially be spread in higher viral loads. And this, of course, is not good if you have not been vaccinated or if you're susceptible to getting this virus.
Okay, that's great information. Thank you so much. Earlier this month, the CDC provided new recommendations for schools and masking. The CDC said individuals ages 12 and older who are fully vaccinated do not need to wear masks. Those who are not vaccinated, you know, that's just, there's a lot of confliction here, but soon the California Department of Public Health updated their guidance for K through 12. Their guidance is that all individuals, regardless of vaccination status, must wear masks indoors while on school campuses. And just 2 days ago, on Monday, the American Academy of Pediatrics recommended that everyone over the age of 2 wear masks, even if they are vaccinated against COVID-19. So this is where we are right now. School is right around the corner. Dr. Rosal, now that kids will be going back to school and we're seeing an increase in infections with the new Delta variant among non-vaccinated groups, should we be more concerned for these kids whose parents have not been vaccinated, or maybe who have been vaccinated? Or teachers.
Right. Well, the concern, of course, is for those that either can't get a vaccine because of age or haven't been vaccinated, because as we can see, this virus, now this Delta variant, can spread a lot faster. And, you know, as I mentioned before, in children, up to 50% can be asymptomatic. So, you know, kids are a great channel to spread this virus. So the American Academy of Pediatrics, the California Department of Public Health has recommended that in California, all children and adults in public schools and all districts will need to be masked and to maintain a certain level of social distancing that the schools can provide. The CDC originally recommended, well, their current recommendation, I should say, is that if children have been vaccinated, they don't have to wear a mask. But this is not according to the California Department of Public Health and it's not according to the American Academy of Pediatrics. So, like I mentioned, in California, kids will need to be masked. But probably they may be reevaluating, the CDC may be reevaluating this recommendation. As we are seeing the number of Delta cases increase, it could be that they will re-implement the masking guidance as previous.
We know these work.
And we know they work.
Yeah. And the sooner we all get vaccinated, hopefully the sooner we can get out of this pandemic.
Hopefully so.
Okay. I do want to ask you a couple of questions. This person submitted her questions a few days ago. It says, we have heard that asymptomatic carriers can transmit coronavirus if their viral load is high enough. Is this a true statement? If so, as a vaccinated parent, can I transmit the virus to my unvaccinated child?
So potentially, even though the risk of transmitting the virus when you've been vaccinated is extremely low, theoretically, yes, you can transmit it to a person that has been unvaccinated. This is probably more important if you're going into a setting, like a closed setting, where you don't know the vaccination status of other people. But right now, the recommendation is that even if a parent, even if a child has not been vaccinated, family members that have been vaccinated in their own home do not need to mask.
Okay. Thank you for that. Her follow-up question is, how should I prepare to deal with a possible outbreak at school? And there is a good chance that we will be seeing this.
Right. Again, you know, kids are great transmitters of viruses, and so there have been clusters in areas in other states where children went to in-person learning, and we saw that there were outbreaks. So I would recommend, just as in any circumstance where anybody could be exposed, if you learn that your child was exposed to COVID-19, it is best to get tested, and whatever the results are determines what happens next. So if your child is positive, then of course there will need to be 10 days of quarantine from the date of exposure, any medical treatment that is, you know, necessary depending on the symptoms. And the schools will have their plans as to how to mitigate these circumstances.
So we suggest you call your school or go on their website or your school district and get more information and probably ask for what their plan is. Right. For those of you joining us on Facebook, thank you so much. If you have any questions regarding this topic, please send them our way. And at the end of this presentation, Dr. Rosal will answer some of those questions. You work here at SVMC PrimeCare Monterey. You see lots of patients, different ages, children and teens, young adults. The pandemic has changed everyone's lives, right? Right. What have you seen with young people, kids, children, teens, in terms of their health, emotional being, depression, anxiety?
Right.
Can you talk a little bit
Absolutely.
about that?
So, children and adults, and adolescents, and in particular adolescents that I've seen in my practice, they've been affected emotionally. You know, having to lock down is, you know, new and pretty frightening. The level of isolation from friends has affected them in terms of anxiety and depression, and even just the uncertainty of what this pandemic could bring was highly affecting their mental health. You know, many kids did well because they have very good social support, or they're quite resilient. But there are kids that you know, really needed that social contact. So I would say that if there is, you know, if there's any evidence that your child might be suffering from some kind of mood change, and it's not always going to look like an adult. It's not always going to be sadness, or they're not even going to express sadness. It could be anger, it could be irritability, could be isolation from the family. Anything that doesn't look like they're behaving their normal self, please talk to your primary care provider, because there could be treatment, there could be resources, for example, counseling. And what I would say in terms of the social isolation, I mean, we're open up a little bit more now, so that's changing. But even if parents are still being cautious, for example, if you haven't vaccinated or your child doesn't have a vaccine because of age, set up scenarios where they can have some social contact, even if it's distanced. So outdoor activities or setting up Zoom meetings, maintaining contact even through social media or digital means.
Okay. It's become a bit of a pandemic within a pandemic. Right?
Correct.
The way that this pandemic is affecting these young individuals.
Right.
Okay. Well, recently the CDC has been receiving increased reports of myocarditis in adolescents and young adults after they receive the COVID-19 vaccine. So let's start with myocarditis. I can't pronounce this word. What is it?
So myocarditis is an inflammation of the cardiac muscle, the actual heart muscle. It's rare. Different sources give different numbers, but it's about 1,000 cases out of 300 million doses of any of these mRNA vaccines. It mostly affects males over the age of 16, but there's a large age variance within that. It usually happens after the second dose, and you could see it about within a week of the second vaccine. The good thing to know about this is, again, it's not only is it rare, but it is also very treatable, and the majority of patients that have contracted developed myocarditis have resolved completely, gone back to normal. I think the other important thing to know is that myocarditis doesn't only occur after getting a COVID vaccine, it actually occurs in patients that have had COVID, and it can be a lot more severe.
But studies are still happening.
Studies are still happening to look at the link. I think, like anything, this is new, everything is evolving. The most important thing is that it's rare and treatable.
What should parents look out for? I mean, what are the signs and symptoms after they receive that second vaccine for myocarditis?
Right. So the symptoms, again, might appear, within a week, usually about 4 to 5 days, and they can appear as chest pain, shortness of breath, having difficulty with exertion. They might not be as active because of these symptoms, and then once in the hospital, the medical team will probably conduct tests which will show some abnormalities showing inflammation or some kind of effects on the heart.
And the good news about all this is that it is treatable. It will go away.
Correct.
Okay. Well, the CDC continues to recommend COVID-19 vaccination for anyone 12 years of age and older. Now, speaking of the vaccines, we want to remind the community that our Salinas Valley Medical Clinic is offering COVID vaccines to anyone eligible 12 years of age and older. To schedule an appointment, please visit myturn.ca.gov. Answer the eligibility questions, enter the 93909 zip code, and click Salinas Valley Medical Clinic option. COVID vaccines are being administered at our SVMC PrimeCare Salinas location. PrimeCare is located at 355 Abbott Street in Salinas. For more information, you can call that number on the screen. It's 751-7070, 751-7070. I do want to remind you, again, the vaccines are free, and minors must be accompanied by a parent or legal guardian. I do have additional questions here for you. Is the vaccine dosage that's given to children, so 12 and older, who most likely will weigh less than an adult, is the dosage of the vaccine the same as the one that's given to the adult?
I believe the dosage for the 12 and older group is the same. What they're doing in the trials is using smaller doses for those younger age groups. So, for example, for the age group of the 5 to 11 years, they're using 10 micrograms as opposed to the 30 micrograms that is given in adults. And in the children 6 months to 10 years, it's about 3 micrograms.
Okay, we have a few more questions here. When will we know if we will need a booster shot of the COVID vaccine?
So currently the CDC has not given any guidance as to whether we will need a booster. However, Pfizer is conducting some trials for a booster vaccine.
Okay. Another question here. Can pregnant women receive the COVID vaccine?
Yes.
What about women who may be breastfeeding?
Also, because once you receive the vaccine, you make antibodies, which you can then give to your infant, and that will protect your baby as well. We know that COVID-19 affects any age, including newborns.
Okay, very important to know. What are the long-term health effects of the vaccine for young people? Infertility? Are there other health issues that we don't necessarily know too much about?
Right. So as of now, many of the sources for medical data and research has not shown that there's any link to infertility. Obviously, we're still studying this vaccine, but there is nothing conclusive to say that it causes infertility or any long-term effects as of yet.
Okay. Is there anything you would like to add regarding COVID-19, the vaccines, vaccinations in general, before we wrap up?
Absolutely. So, as I mentioned earlier, I can understand why some parents, or most parents, I should say, can be concerned about giving this vaccine. It's new, it's not FDA approved, we're still learning a lot. But all I can say is that the state of how this pandemic is going, the Delta is spreading pretty fast. It's, you know, the concern with that is it can mutate, and we don't know what these other variants can do. We do know that the vaccines are highly effective, mostly for prevention of hospitalization, severe illness, and death. And it is effective against transmission. Not 100%. I think there's a lot of new information coming out in the news about breakthrough cases. Well, a lot of the folks that have had these breakthrough cases have very mild disease, but can they transmit it to someone else? We're going to have to see. We are seeing that there are pockets in the United States where people haven't been vaccinated with high rates of hospitalizations and death at this time, and they have been the unvaccinated. So everyone has to weigh the risk for themselves, but I think I can trust these organizations that have looked at this research and data and highly recommend that people consider and get the vaccine and administer it to their children.
Okay. I appreciate that. I do want to thank you for your time and for being here today. Great advice, great information. Hopefully those of you out there who've been on the fence about getting the vaccine will go and get that shot in the arm. I don't know about you, Dr. Rosal, but when I received the first dosage, or the first dose, I was very happy. I got a little teary-eyed. So it's important to be able to return to normal and see our loved ones and our families and keep moving. So thank you for that. And thank you to all of you for viewing, for watching this Ask the Experts event. Next month, we will be focusing on strokes. Those Spanish and English language Ask the Experts presentations will take place Thursday, August 26th at 3 p.m. and at 4:30 p.m. Our guest will be Salinas Valley Memorial Healthcare System Stroke Center Medical Director, Dr. Rene Colorado. So please join us for that. Again, he's bilingual, just like Dr. Rosal. So we'll be hosting two of these events back to back in English and Spanish. Today's video will remain on this Facebook page. So please like it and share it. We really appreciate it. Thank you so much, and we'll see you next month. Take care.